Good afternoon and welcome to the Assembly Committee on Health and Human Services Friday edition. Would the Secretary please take the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Here. Assemblyman Hafen. Here. Assemblyman Hibbets. Here. Assemblyman Koenig. Here. Assemblywoman Newby. Assemblyman Wynn. Here. Assemblyman Orentlicker. Here. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
And I am here. Please mark Assemblywoman Newby absent excused today. We have two items on the agenda, including public comment, but the first item we're going to do is work session. A couple housekeeping items which are pertinent to today. Please silence your electronic devices so we're not interrupting folks with little dings and rings. Second, we will have public comment at the end of the agenda today, and you may provide public comment in a variety of ways, all of which are listed on the agenda. Public comment in writing is can be submitted up to 24 hours upon meeting's adjournment. If you are asked to come up to the desk today for any clarifying questions, please remember to turn on the mic to speak and off to listen so we can avoid any reverb in our recording. With that, we'll move on to the work session agenda. As a note for members, we have pulled AB 154 off of the agenda and we will place that on hold for a period of time. So we will go in order, I believe, of our work session agenda today, starting with Assembly Bill 99. Mr. 154. We pulled Assembly Bill 154. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, Legislative Council Bureau. Just my usual reminder, as nonpartisan staff, I can neither advocate nor oppose any measures before you today. We will start with Assembly Bill 99, which was heard on March 17th. And for the sake of time, I will skip right to the amendments proposed by Assemblywoman Brown-May. Please see also the attached conceptual amendments in the work session document. In summary, the amendments replace the current provisions of the bill as follows. Number 1, require the division to submit a report of its finding from the quadrennial rate reviews to the IFC and the Joint Interim Standing Committee on Health and Human Services no later than January 31st, 2026 and every 4 years thereafter. Number 2, require the division to conduct a study to determine the cost to the State General Fund. And the study requirements are outlined in items A and B. Number 3, require the division to submit a report of the study's findings and certain recommendations to the IFC and the 2025 legislative session no later than November 15, 2024. And number 4, define long-term care provider as providers of Medicaid home and community-based waiver services, including home health and private duty nursing services. Madam Chair.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. Thank you. I have a motion from Assemblywoman Taylor and a second from Assemblywoman Gorlow. Any discussion on the motion? Seeing none. All those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes with those present. We'll move on to AB 100. Mr. Ashton. Oh, that would be Brown-May, please.
Thank you. Patrick Ashton, Research Division, LCB, for the record. Assembly Bill 100, which was heard on March 17th, requires the HHS during the 2023-2024 interim to develop certain evidence-based and culturally sensitive assessments, implement a pilot program to administer these assessments to family caregivers, and annually report on the progress and results of the pilot program to certain entities. Further, this bill requires the department to conduct 2 separate caregiver studies during the next interim. Amendments. Assemblywoman Brown-May proposes the following amendments, and see also attached to the work session document. In section 1, number 1, replace in subsection 1A the phrase hospitals, managed care organizations that provides that provide services to recipients of Medicaid, other providers of publicly funded services for older persons, and persons with disabilities, and providers of healthcare with the department, and add certain requirements to an assessment. Number 2, revise subsection 1D to require the department to recruit volunteers for the pilot program. Number 3, add to subsection 2C the legislature. As an additional entity, the department must submit the report to you. Number 4, delete in subsection 3 definitions for hospital, managed care organization, and provider of healthcare. And other amendments. Number 5, delete section 2, thereby removing the additional 2 separate caregiver studies. Chair Peters.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. Assemblywoman Gonzalez made the motion. I have a second from Assemblywoman Gorlow. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Motion passes with those present. I can go ahead and give that floor statement to Brown-May, Assemblywoman Brown-May, and we can move on to Assembly Bill 114.
Thank you. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 114, which was heard on February 20th, revises the membership of the Nevada Early Childhood Advisory Council and also defines the term Early Childhood Program for purposes of the duties of the Council as any program for children less than 8 years of age pertaining to certain educational topics. Amendments. Assemblywoman Thomas proposes the following amendments to Section 1, and see also attached document here. In number one, in subsection 1E, clarify that the governor shall appoint either one council member who is a representative of Nevada's Department of Education or who is a representative of the Department of Health and Human Services, whose duties include responsibilities for programs under Part C of the Individuals with Disabilities Education Act. Number 2, in subsection 1Q, require the governor to give preference to members who are parents or guardians representing diverse populations of the state. And number 3, in subsection 5, replace or with and. Assemblywoman Peters proposes the following amendments. 2, in subsection 1P, require the governor to appoint a representative of a tribal organization after considering any recommendation of an enrolled member of a Nevada Indian tribe, which is submitted by the Nevada Indian Commission. Chair Peters.
Are there any questions? I would entertain a motion to amend and do pass.
So moved.
Assemblywoman Gonzalez makes the motion. Do I have a second?
Second.
Thank you, Assemblywoman Thomas. The conceptual amendment? On 114?
Yes.
Assemblywoman Thomas has so we've already made the motion. I had that one on 167. Yeah?
My fault.
Oh, we're good. Okay. Sorry, we have an additional friendly amendment on Assembly Bill 167, but since we are on a motion on Assembly Bill 114, all those in favor, are there any questions on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? The motion passes with those present. We will give that to Assemblywoman Thomas and move on to Assembly Bill 167, which has an additional amendment that we will add on after Mr. Ashton goes through the summary.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 167 was heard on March 10th, and it requires ADSD DHHS to establish and administer a program for dementia care specialists to support and assist in various ways persons with dementia and their families and caregivers. This bill makes an appropriation from the State General Fund to the Program for Dementia Care Specialists and sets forth certain other provisions. Amendments. Assemblywoman Thomas proposes to amend subsection 2 of section 1 by adding a program goal to assist persons with dementia and their families and caregivers whose language is other than English to access the program through translation and interpretation services. Chair Peters.
In addition, we have a friendly amendment to add Assemblywoman Taylor and Assemblywoman Gonzalez as co-sponsors. Are there any questions from the committee? Yeah, Assemblyman Gray. All right, we'll follow up later. Any other questions? Seeing none, I would entertain a motion to amend and do pass.
So moved.
Thank you. I have a motion from Assemblywoman Gonzalez and a second from Assemblywoman Gorlow. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Motion passes with those present. I would give that floor statement to Assemblywoman Thomas. Thank you very much. We'll go ahead on to AB 201. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 201, which was heard on May 27th, expands the responsibilities relating to the provision of behavioral health services of the Commission on Behavioral Health, DPPH, and DCFS. The bill requires the Commission to track the spending of federal and state money, quantify and track cost savings, and provide oversight for reinvestments in the children's behavioral health system of care, among other provisions. Amendments. Assemblywoman Peters proposes amendments as conceptualized in the attached mock-up in the work session document. In summary, the amendments, number 1, remove sections 3 and 9, requiring DPBH and DCFS to formulate and operate state plans and make conforming sections throughout the bill. Number 2, clarify that DPPH is authorized to certify any behavioral health care facility operating in a state and adopt any necessary regulations. Sorry about that. Number 3, require the HHS Interim Committee, in collaboration with various state and local entities, to conduct an interim study on the feasibility of a comprehensive state plan to provide a continuum of behavioral health care services. Number 4, revise Section 2 by requiring DHHS instead of the Commission on Behavioral Health to quantify, track, and make recommendations on the spending of federal and state funds on the children's behavioral health system of care and the reinvestment of certain savings. Number 5, require DHHS to provide regular updates on the analysis, estimate, and any recommendations on reinvesting any potential cost savings to the HHS Interim Committee and the Legislature. Number 6, add new provisions creating a statewide mental health consortium to represent existing regional mental health consortia. The statewide mental health consortium and each regional mental health consortium may request the drafting of one legislative measure within the scope of the statewide or regional consortium as applicable. And number 7, reinstate the requirement that the subcommittee on the mental health of children of the Commission on Behavioral Health to create a statewide plan for the provision of mental health services to children, and add as members to the subcommittee a parent of a child with an emotional disturbance who is a member of the statewide mental health consortium and the chair of the statewide mental health consortium. Chair Peters.
Thank you. Are there any questions from members? Seeing none, I would entertain a motion to amend and do pass.
So moved.
Thank you. I have a motion from Assemblywoman Gorlow and a second from Assemblywoman Thomas. Are there any discussion? Yeah, Assemblyman Hafen.
Thank you, Madam Chair. I'm going to be a no today, but reserve my right. Hopefully we can get to a yes. I need just further time to digest the amendment to make sure that all of my concerns were addressed in it. Hopefully I can get to a yes when we get to the floor, though. Thank you.
Thank you. Other discussion? Assemblyman Koenig.
I ditto what Assemblyman Hafen said.
Thank you. I appreciate the heads up, but I do want to just put out there that you do not have to let me know that you reserve your right. Everyone has the right to change their vote. I do appreciate a heads up if you choose to change your vote, but understand where you're coming from. Any other discussion? Seeing none, I would, all those in favor, please signify by saying aye. Aye. Those opposed, nay. Please raise your hand so we can get a count. I have a nay from Assemblyman Hafen, Assemblyman Koenig, and Assemblyman Hibbets. Motion passes. And I will take that floor statement. Assembly Bill 202, Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 202 authorizes a patient in a skilled nursing facility or the patient's representative to request the installation and use of an electronic communication device in a patient's living quarters if certain conditions and requirements are met. The bill sets forth certain prohibitions, all of which are noted on the bill page, and for violations of the bill's provisions, a person or entity is subject to certain civil and criminal penalties, and a facility may face additional disciplinary action. Amendments. Jonathan Norman, Nevada Coalition of Legal Service Providers, proposed during the bill hearing to revise Section 8, requiring a guardian who is the representative of a patient to apply to a court for the authority to consent to the installation and use of an electronic communication device if a court has not granted such authority yet. Chair Peters.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion to amend and do pass. I have a motion from Assemblywoman Thomas and a second from Assemblywoman Taylor. Is there any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Motion passes with those present. And I would assign that floor statement to Assemblywoman Summers Armstrong. Thank you. All right. Assembly Bill 206, Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 206 was heard on March 17th. It adds a 12th member to the Nevada Commission for persons who are deaf and hard of hearing, who must be a registered sign language interpreter and possess certain experience and knowledge. There were no amendments. Chair Peters.
Thank you. Are there any questions from the committee? Seeing none, I would entertain a motion to do pass. For a motion from Assemblywoman Taylor and a second from Assemblyman Nguyen. Any discussion on the motion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed, nay? Motion passes with those present. And I would assign that floor statement to Assemblywoman Brown May. Moves us to Assembly Bill 277. Mr. Ashton.
Thank you, Madam Chair. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 277, heard on March 24th, establishes a rural emergency hospital as a unique type of medical facility licensed and regulated by the State Board of Health and DPPH. The board must adopt regulations for the licensure of rural emergency hospitals, which take into consideration the unique problems of operating such a facility in a rural area. The department may apply for a waiver or an amendment to the state plan for Medicaid to receive federal funding to increase reimbursement rates for rural emergency hospital services. Finally, AB 277 authorizes the division to issue an endorsement as a crisis stabilization center to a rural emergency hospital if certain requirements are met. There were no amendments. Chair Peters.
Thank you, Mr. Ashton. Are there any questions from the committee? Assemblywoman Gonzalez.
Thank you so much. I would like to be added as a co-sponsor, please.
Assemblywoman Thomas and Assemblywoman Gonzalez would like to be added as co-sponsors, and, oh, okay, yep, and Assemblyman Hafen and Assemblywoman Taylor. And Assemblywoman Gorlow and Assemblyman Orenlicker. All right. I have a motion to amend and do. Assemblyman Hibbets, are you already on there?
I'm not sure, so if I'm not going through
All right, we'd like to keep.
You were at all.
I think I'm the only one who's not on there. You could add me on there too. We'll add me on there too. Thank you.
Would it be a shorter one to put?
I don't. Okay. Bring it back in, folks. I would entertain a motion, Assemblyman Gray, to amend and do pass. Thank you, and Assemblyman Nguyen with the second on that one. I feel like this is just a formality discussion on that motion. All those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes with vigor. And I would assign that floor statement to Assemblyman Koenig. Nice job. All right, this brings us to our last bill, Assembly Bill 289. Mr. Ashton.
Thank you, Chair Peters. For the record, Patrick Ashton, Research Division, LCB. Assembly Bill 289 was heard on March 27th, and it authorizes the use of natural organic reduction for disposing human remains, which is the contained accelerated conversion of human remains to soil. The bill includes natural organic reduction in the definition of cremation, thereby applying existing penalty provisions for violating requirements governing the disposition of human remains, and the licensing, permitting, and certification of operators and facilities for the disposition of human remains. Upon written consent from local authorities, crematories using only natural organic reduction may be located within certain cities and towns. The bill exempts soil resulting from natural organic reduction from the size requirement for cremated remains and makes several other conforming changes. There were no amendments, Madam Chair.
Thank you, Mr. Ashton. Are there any questions from the committee? I would entertain a motion to do pass.
Second.
Thank you. I have a motion from Assemblyman Gray and a second from Assemblywoman Gonzalez. Is there any discussion on the motion? All those in favor, please signify by saying aye. Aye. Any opposed, nay. Motion passes with those present, and I would assign that to Assemblyman Carter. All right. All right, that brings us to our last item on the agenda, which is public comment. Public comment can be provided in a variety of ways, all of which are listed on the agenda. We will take public comment in person first here in Carson City. If there's anyone who would like to provide public comment today, please come up to the desk. Seeing none, I would ask BPS to check the public line for public comment today.
Chair, the public line is open and working, but there are no callers at this time.
Thank you so much. Well, that brings us to the end of our agenda. We'll close out public comment, and our next meeting will be on Monday at 1:30. We have a couple bills on Monday, and we may have a work session, so we will send out that information as it is ready. With that, we are adjourned.